Thrive in Motherhood is a health education program sponsored primarily by the El Paso County Health Department to help facilitate healthy pregnancies for maternal women and their developing infants throughout Colorado Springs. This is a concern in this city as a low birth weight rate is less than optimal. Low birth weight is associated with 17% of infant deaths. Of the 9,375 live births in Colorado Springs, approximately 956 infants are low to very low birth weight births in Colorado. The Healthy People 2020 objective is to decrease the low birth rate to under 7.9%. Colorado Springs' current low birth weight rate is a high 9.8%. The goal of Thrive in Motherhood is simple: to reduce the low birth weight rate and infant mortality rate in Colorado Springs, Colorado. The well-being of maternal women and their developing children are the only motivation for this campaign, and no ulterior motives will be tolerated by those who contribute to this program. The goal for Thrive in Motherhood will be pursued through 10 objectives, 4 process objectives, 4 behavior objectives, and 2 outcome objectives. The 4 process objectives are as follows. 1. Within the first 2 weeks of the Thrive in Motherhood launch, presentations will introduce the Thrive in Motherhood initiative and recruit WIC, KOAA local news, the local YMCA centers, Colorado Springs Public Libraries, the Dream Centers of Colorado Springs Pregnancy Centers, and Pikes Peak Community College. 2. Messages and materials will be pre-tested by 2 separate groups within 6 weeks of launching the Thrive in Motherhood campaign, and each group must rate the materials 7 or above on a 1 to 10 scale in order to proceed to ensure material effectiveness prior to dissemination. 3. Within the first 2 months of this program's initiation, KOAA Local News will air 4 specials regarding the Thrive in Motherhood initiative and provide contact information for maternal women to connect with Thrive in Motherhood once each day to create awareness of the maternal health struggle and regarding how Thrive in Motherhood is addressing infant mortality and low birth weight rate in Colorado Springs. 4. By the 2nd month of the program's initiation, the Public Library, the Pregnancy Centers, the YMCA, Pikes Peak Community College, and the Colorado Dream Center will distribute information regarding the Thrive in Motherhood initiative and maternal health to 75% of all maternal women in Colorado Springs area. The Thrive in Motherhood behavior objectives focus women on the main requirements for healthy pregnancy. These are: 1. At least 85% of the maternal women participating in the Thrive in Motherhood initiative report participating in maternally appropriate physical activity at least 3 days a week, 4 months after the launch of the Thrive in Motherhood initiative. 2. At least 85% of the maternal women participating in the Thrive in Motherhood initiative report consuming the appropriate serving amounts of grains, proteins, fruits, vegetables, and dairy at least 5 days a week, 4 months after the launch of the Thrive in Motherhood initiative. 3. At least 80% of the maternal women participating in the Thrive in Motherhood initiative report avoiding all tobacco products and alcoholic beverages 5 months after the launch of the Thrive in Motherhood initiative. 4. At least 85% of the maternal women participating in the Thrive in Motherhood initiative report attending 90% of all recommended prenatal appointments 6 months after the launch of the Thrive in Motherhood initiative. Outcome objectives. By the end of the 2-year Thrive in Motherhood timeline, low birth weight rate will decrease from 9.8% to 8.6% among maternal women in Colorado Springs. 2. At least 40% of the maternal women who participated in the Thrive in Motherhood initiative pursue higher education through the opportunities provided through Pikes Peak Community College at the end of the 2-year timeline. Campaign design. The generalized model is a systematic plan to promote behavior to enhance health. Through careful planning, 5 tasks, assessing needs, setting goals and objectives, developing interventions, implementing interventions, and evaluating results, programs may be implemented efficiently and effectively to improve the well-being of the target audience. This plan is the basis for the health education plan Thrive in Motherhood is following. The CDC Synergy model, however, is also being utilized in enhancing the steps of the generalized model. The CDC Synergy model is a systematic health communication model developed thoroughly for health education program planning. Much of the need assessments, goal and objective settings, and intervention development for the Thrive in Motherhood program have been heavily influenced by the CDC Synergy model, which has helped this strategy have a solid foundation and a promising outcome. The trans-theoretical model. Although making resources available to the maternal target population is of great importance to the Thrive in Motherhood initiative, it will be the improvement of wellness behaviors which will be most influential in achieving the Thrive in Motherhood's ultimate goal of reducing the low birth weight rate and the infant mortality rate in Colorado Springs, Colorado. To help maternal women with improving their wellness behaviors, the trans-theoretical model will be employed to help guide health education specialists as they approach the Thrive in Motherhood participants. The trans-theoretical model of behavior is a model examining stages of behavior change. This model identifies how ready individuals are to adapt new behavior. The 5 stages of change and the process which takes place in order for change to be effective are the main attributes of the trans-theoretical model's planning strategy. The stages of the trans-theoretical model are pre-contemplation, contemplation, preparation, action, and maintenance. And these stages are not always linear, but rather individuals may move back and forth within the stages as they make progress or regress. Through utilization and recognition of these stages within the Thrive in Motherhood program, health education specialists may best suit wellness education to the women's progression needs. The information processing theory and health belief model. The target population of the Thrive in Motherhood initiative, those in low HCS, those with limited academic education, and those of ethnic minority status, often struggle with health literacy and cultural barriers. For this reason, the information processing theory and health belief model will be employed by the Thrive in Motherhood material design and education dissemination. The principles of the information processing theory are that communication is to be simple, attractive, easy to comprehend, and design is utilized effectively to convey the message. This is important for those struggling with health literacy as well as cultural barriers, as the message may easily be lost in professional jargon or too much information. The theory of health belief model confronts how populations perceive their susceptibility to a health risk, and how factors such as culture and health literacy may influence this perception. This model is sensitive in its approach of other cultures and how other cultures' beliefs may be incorporated into the health message for more effective communication. Through these two strategizing influences, the target population's struggle of health literacy and cultural barriers may be decreased. Campaign meeting maternal needs. The population to be assessed for Thrive in Motherhood are maternal women within the Colorado Springs area at risk for low birth weight pregnancy outcomes or pregnancy complications. There are approximately 9,375 live births in Colorado Springs each year. Of those 9,375 live births, approximately 956 infants are born low birth weight. It is these women at risk for low birth weight pregnancies and pregnancy complications who Thrive in Motherhood most wishes to reach with resources and maternal health education. 5.9% of pregnant mothers in Colorado Springs smoke during pregnancy, and approximately 528 mothers-to-be are under the age of 18 annually in Colorado Springs. The next risk factor is the poverty level within Colorado Springs community. In 2000, the poverty level was 9.1%, and it has since increased to 12.2%. This decrease in social economic status makes improving the low birth weight rate more difficult. As HCS decreases, the risk of low birth weight rates increase significantly. The third risk factor of significance is the decrease of mothers who have attained education further than the high school diploma. In 2004, 15.9% of mothers in Colorado Springs had education beyond high school. This has dropped to 9.1% in 2014. The decrease in academic achievement is also a concern for increased risk to mothers-to-be and their unborn children, as lower education amongst mothers is also related to low birth weight rates in their infants. Ethnicity also plays a part in likelihood for low birth weight pregnancies in Colorado Springs. While non-Hispanic white populations have a birth weight rate of 7.1%, their ethnic counterparts suffer considerably more. Hispanic populations have a low birth weight rate of 7.8%, and African American populations suffer with a birth weight rate of 14.2%, followed by the Asian Pacific Islander population, whose birth weight rate is 10.3% in Colorado Springs. After conducting this needs assessment and surveying the community for current maternal health problems, it is apparent that a health initiative such as Thrive in Motherhood would be a great asset to the maternal women of Colorado Springs. The risk for the women and their developing children is higher than the Healthy People's 2020 goal, and Thrive in Motherhood can improve that. Meeting these maternal needs are the basis for the goal and objectives of Thrive in Motherhood.